Few days back, a 25-year-old lady came to my clinic complaining white discharge per vaginum. I examined the lady and took a pap smear. So the pap smear was reported as CIN grade 3, that is cervical intraepithelial neoplasia or high-grade dysplasia grade 3. So I advised the lady to take further follow-up and treatment. But she refused as the complaint was not very bothersome. Few months later, the same lady came back with a locally advanced cervical cancer which is inoperable. So, cancers do not occur in one day. So, there are stages. First, metaplasia takes place, then dysplasia takes place, and then it leads to invasive cancer. In this video, I am going to teach you the two adaptations, metaplasia and dysplasia. So, you know what are adaptations. Normally, you can see in this image there is a cell. In this cell, normally all the cells in human body are in homeostasis. They have their particular structure, and with that particular structure they perform their particular function. But whenever there is any stress to the cell, the stress may be physiological or the stress may be pathological. Due to this stress, the cell undergo, the first thing the cell react, the cell undergo adaptations. Adaptations are reversible. Once you remove the stress, the cell will take its normal structure and function. So, adaptations are reversible structural and functional changes in response to the stress. In order to survive and overcome the stress, the cell does so. So, the first thing cell do is adaptation. You can see in this flow chart, normally cells are in homeostasis. But whenever any stress acting on the cell, whether the stress is physiological or it is pathological. So, the first thing taking place here is cell adaptation. If the stress is still continued, it is not removed. The second thing cell will do is cell injury. Now, cell injury is of two types. The first, it will be reversible cell injury. So, still it is reversible. Once you remove the stress, again, the cell will take its normal structure and normal function. But after a point of no return, there is a point of no return. If the stress is still continued so severely and persistent stress is there, so irreversible cell injury will take place, which is known as cell death. So, cell death and irreversible injury are same. There are two types of cell death, apoptosis and necrosis. In this video, I am teaching you adaptations. Cell adaptations, the first response to the stress. Cell adaptations are of 5 types. There are 5 types of cell adaptations: hypertrophy, hyperplasia, atrophy, metaplasia, dysplasia. In this image, you can understand the meaning of the 5 types of cell adaptations. In this image, in the center, you can see a normal cell. So, this is a normal cell, normal structure, normal function. Whenever this cell is exposed to any stress, whether physiological or pathological, so the 5 types of adaptations cell can do to overcome the stress. The first type is hypertrophy. Hyper means increase and trophy means size. So, you can compare the size of this cell as compared to normal cell. The cell is increased in size. That is known as hypertrophy. Atrophy means decrease in size. A means decrease and trophy means size. So, here you can compare the size of this cell with the normal cell. This cell decreased in size. The third type of adaptation is hyperplasia. Hyperplasia means increase in number. In this diagram, you can see instead of one cell, there are 3 cells. But if you compare the size of these cells with the normal cell, it is of same size. So, here size is not changed, but the number of cells are increasing. That is hyperplasia. Hyper means more, plasia means number. The fourth type of cell adaptation is metaplasia. In metaplasia, one type of cell, one type of mature cell converted into, replaced by, into another type of mature cell. So, if the cell is squamous, it can be replaced by columnar, or if the cell is columnar, it can be replaced by squamous. That is metaplasia. Replacement or transformation of one type of mature cell by another type of mature cell. That is metaplasia. And the last is dysplasia. The meaning of the dysplasia is disordered development. D for D. It is disordered development in the cell. It is a pre-malignant condition. So, in this video, I am teaching you these two of these adaptations, metaplasia and dysplasia. So, let's start with metaplasia. As I've told you, what is metaplasia? Metaplasia is one of the adaptation, one of the 5 adaptation. So, of course, all adaptations are reversible. So, this metaplasia is also reversible. It is a reversible change in which one type of mature or adult cell, it is replaced by another type of mature or adult cell in response to the stress. If the stress is removed, if the stress is ablated, the metaplasia tissue revert back to the normal tissue. That is the definition of metaplasia. Now, in this diagram, you can appreciate the two types of the metaplasia. As I have told you, if the cell is squamous due to the stress, when stress is acting on the cell, it can be replaced by columnar. This type of metaplasia is known as columnar metaplasia, because finally a columnar cell is formed. The second type, initially the cell is columnar. Normally the cell is columnar, but in response to stress, the stress can be anything, physiological or pathological. In response to stress, it is replaced by squamous cell. So this type of metaplasia is known as squamous metaplasia, because ultimately here squamous cell is formed. So two types of metaplasia are there, columnar metaplasia and squamous metaplasia. In columnar metaplasia, squamous cell get replaced by columnar, and in squamous metaplasia, the columnar cell get replaced by the squamous cell. So ultimately which cell is formed? Finally which cell is formed? That is the name of that metaplasia, columnar metaplasia and squamous metaplasia. These are the two types of metaplasia. We have learned the definition of metaplasia. We have learned the two types of metaplasia. In this diagram also, the 5 cell adaptations are shown. Now see this one, which I am marking. So you can see one type of adult mature epithelia is converted into other type of adult mature epithelia, whether squamous to columnar or vice versa, that is columnar to squamous. So that is metaplasia, the two types of metaplasia. Now coming on the mechanism of metaplasia. How does metaplasia takes place? So metaplasia, it is not the replacement, it is a replacement of the cell, but it is due to the change in formation of the cell by the stem cells. What do you mean by that? So metaplasia is a result of reprogramming of the stem cells. Reprogramming of the stem cells. So here I would like to draw a diagram for you. So you can imagine this is any tissue having columnar epithelia. With this red color, I am drawing columnar epithelia. Now in normal tissue, we have few cells. Those cells are known as stem cells. These are the stem cells which are giving rise to this columnar epithelia. So this columnar epithelia is arising from the stem cells. The blue color one, few cells are stem cells. Normally in this tissue, the stem cells are giving rise to columnar epithelia. Now when it is subjected to stress, when stress is falling on this tissue, on this organ, so these stem cells, they get reprogrammed. Till now they get reprogrammed. Till now they were forming the columnar epithelial cells. Now because of reprogramming, they will start formation of squamous cell from now onwards. So gradually, now squamous epithelia will be formed. So gradually down the line, squamous epithelia will replace the columnar epithelia. That is the meaning of reprogramming of the stem cell, and that is the mechanism of metaplasia. You can understand that why I am insisting on this point. It is not the cell which is already formed. It is columnar cell is replaced by the squamous cell. Now you can see the new cell which are formed will be squamous. So gradually the columnar will be replaced by squamous. It is not the cell which is already squamous will get converted into squamous. The columnar will get converted to squamous. It is the new cell which is formed, will be of different lineage, that you can say. So same is shown in this diagram also. In this diagram in front of you, you can see these cells are columnar cells, which I am drawing with blue color. They are ciliated. You can appreciate the cilia also. It is columnar cells. And on the other way round, you can see the blue cells. These are squamous cells. These all are squamous cells. They are gradually replacing this columnar cells because of reprogramming of the stem cell. That is the mechanism of metaplasia. Now coming on the types of metaplasia. How many types of metaplasia are there? There are two types of metaplasia. Both of them are epithelial metaplasia. Squamous metaplasia, columnar metaplasia. So squamous metaplasia means normally tissue is columnar, and after metaplasia it get converted to squamous. That is the meaning of squamous metaplasia. In columnar metaplasia, normally the tissue is having squamous epithelia, but after adaptation, after metaplasia, it will convert into columnar. So the point is that finally which tissue is formed, that is the name given to that metaplasia. Squamous metaplasia, columnar metaplasia. Finally which epithelial tissue is formed. Initially it doesn't matter. Finally after metaplasia, which epithelia is there, that is the name given to that. Now the important thing is to learn the example of these types. So I will teach you the examples of each of these two types, the squamous metaplasia as well as columnar metaplasia. So let me start with squamous metaplasia. As I have told you, the definition, always insist on the definition. So it is columnar epithelia which get converted to squamous epithelia because of metaplasia. Now tell me the name of 5 tissues in human body which normally have columnar epithelia. And tell me the stress, because of the stress, they get converted to squamous metaplasia. So tell me the name of the stress also, right? So 5 organs in human body are, number 1, lung. You can say lung. In the lung, trachea, bronchi, that is the first organ. Second, you can say gallbladder. It also have columnar epithelia. The lung have pseudostratified ciliated columnar epithelia. Gallbladder, it also have columnar epithelia. You can say prostate. Prostate in males. Prostate also have columnar epithelia, right? That is the third example. Fourth is nose. Nose and the respiratory tract. Again, it is having columnar epithelia. And the fifth and the last one is endocervix in female. I'm not saying ectocervix. I'm saying endocervix in female, right? First understand, I will draw the diagram for all 5. In these 5, there is some stress. So let me tell you the name of the stress in each of them. So in each of them, normally columnar epithelia will get converted to squamous epithelia in all of them because of some stress. So can you name the stress? What is that stress in each of them? What is that stress? Okay. So the name of the stress, in case of lung, the stress can be smoking. Now, God has given the lung to do the respiration, but some people misuse it and do smoking. So the epithelium of the lung, the trachea, the bronchi, the respiratory tract, you can say. So smoke is acting as a stress for this epithelium, which is columnar epithelium, and it gets replaced by the squamous epithelium. So smoking is the stress. In case of gallbladder, stones can be the stress. Sometime in gallbladder, calculi are formed. The stones are formed. So because of which the columnar epithelia in the gallbladder is replaced by the squamous epithelia. That's second example. In case of prostate, infection or inflammation can be the stress. So in case of prostatitis, that is itis, inflammation of the prostate. So normally columnar epithelia, which is there in the prostate, it will be replaced by squamous epithelia. In case of nose, vitamin A deficiency. Vitamin A deficiency can be the stress. So normally nose, the pharynx, larynx, they have columnar epithelia. But in case of vitamin A deficiency, which is acting as a stress, the columnar is replaced by the squamous epithelia. Last is endocervix. Now female cervix is a organ in the female, right? Genital organ in the female. So cervix have 2 portions, endocervix, ectocervix. Endocervix have columnar epithelia. So here uterine prolapse of the uterus can be the stress. So which is causing mechanical stress over the endocervix, because of which the columnar epithelia in the endocervix can be replaced by squamous. So I guess you got the 5 examples along with their stress. Now let me draw their diagrams one by one. So here I will show you in the diagrams, the 5 examples are written here which I have enumerated. So you can see the bronchus or the lung where stress is the smoking, right? You can appreciate that. The second is the female endocervix where stress is the prolapse of the uterus. You can see the third example, gallbladder, where stress is the calculi, that is cholelithiasis, that is stones or calculi. In prostate, in males in prostate, the stress is the chronic prostatitis, that is inflammation in the prostate. And you can see the last example, nose, bronchi, lacrimal and salivary glands. Vitamin A deficiency is the stress which is leading to this metaplasia. We will draw some diagrams of these examples for better understanding and retention. So let me draw the first example. In this example, you can see this is trachea and this is the 2 bronchi which are leading to further division, bronchioles and everything in the lungs. So normal epithelia here is columnar. So red color epithelia here I am drawing is columnar. This epithelia is columnar everywhere. But if the person is doing smoking, so here is the smoke. Can you see? This is the smoke. Now this smoke is putting stress on all these cells. So this columnar epithelia will be replaced by squamous epithelia due to reprogramming of the stem cell. So this is the first example. Here the stress is the smoke. Smoke is the stress. So columnar get converted to squamous. The first example in case of lung or trachea and bronchi. The second example is the gallbladder. Let me draw a gallbladder for you. So this is a gallbladder. In humans, there is a gallbladder in which concentration of the bile takes place. Bile is required for emulsification of the fat and, for emulsification and absorption of the fat which is present in the diet, we require bile. Bile concentration takes place in gallbladder. Gallbladder lining is again columnar. Normal lining in human beings, it is columnar. But in some humans, calculi are formed. So let me draw here calculi. It is a stone. Lithiasis. It is known as cholelithiasis. It is acting as a stress over all these cells. So because of this stress, the squamous will get converted to columnar. Again, it is an example of columnar. Columnar get converted to squamous, and it is an example of squamous epithelia. That is the second example. Let me move on the third example, prostate in males. So let me draw a urinary bladder and a urethra. So you can see prostate is the gland present here just at the neck of the bladder. The normal lining of the prostate is columnar, you can see, but because of infection, inflammation, because of chronic prostatitis, this columnar lining can be replaced by squamous. So that is squamous metaplasia, the third example, that is prostate. The fourth, you can understand, I do not need to draw the diagram. In case of salivary gland, in case of lacrimal gland, in case of nasal glands, in the glands, the normal lining here is again columnar. In case of vitamin A deficiency, it is replaced by squamous. The last diagram which I like to draw here is the female uterus and cervix. Let me draw a diagram of female uterus and cervix. This is female, this is uterus, this is cervix, and this is vagina. Can you tell me the lining of the cervix? Can you tell me what is the lining? Okay, let me tell you what is the normal lining of uterus. The normal lining of uterus is columnar. Can you see this lining is columnar? I am drawing with red color. Can you see what is the normal lining of vagina? The normal lining of vagina is squamous. I am drawing with blue color. This is normal. But at the junction of the uterus and vagina, there is cervix. So can you tell me what is the normal lining of the cervix? So is it like uterus, columnar, or is it like vagina, squamous? So we divide this cervix into two portions, the upper half and the lower half. The upper half is the continuation of the uterus. That's why it will have columnar epithelia. So this is columnar epithelia. You can see, and the lower half is the continuation of the vagina from below. So you can see the lower half of the cervix have squamous epithelia. So cervix is divided into two portions. So the upper half is known as endocervix, and normally it is having columnar epithelia. You can appreciate in the diagram. The lower half of the cervix is known as ectocervix, and it is lined normally by squamous epithelia, you can see. Now, I will tell you two stress, one for ectocervix, one for endocervix. So, both of them can show the metaplasia. Let's talk about endocervix first. In the endocervix, you can see here in the endocervix, normally lining is columnar. But imagine this uterus is doing the prolapse here. The uterus is falling into the cervix. That is prolapse of the uterus in the cervix. So, that is causing stress over here in the endocervix. And due to this prolapse of the uterus into the cervix, the columnar epithelia will get converted to squamous. So that is the example of squamous metaplasia. In squamous metaplasia, the example is endocervix. Let's talk about ectocervix. In ectocervix, the stress is a viral infection, HPV. HPV virus. HPV is a virus which can cause infection in the cervix, and because of which the metaplasia can take place here in the cervix. So normally ectocervix has squamous epithelia, it will get converted to columnar epithelia. So I can say female cervix is an example of both metaplasia. The endocervix is an example of squamous metaplasia in which columnar get converted to squamous, and the ectocervix is an example of columnar metaplasia in which squamous get converted to columnar. The stress are different. You can learn the stress. Now this diagram is the diagram in which I have explained you the mechanism of both type of metaplasia in cervix. So let me move to the second type of metaplasia, that is columnar metaplasia. So what is the definition? Here normally the organs have squamous, and because of stress it get converted to columnar. Because of stress it get converted to columnar. Squamous get converted to columnar because of stress. That is the definition, which is just reverse, just opposite as we have studied in squamous metaplasia. So here we have only two examples, not five. We have two organs here. So what are the two examples here? Here we have the first example is the esophagus. The first example is the lower esophagus, in which normally we have squamous epithelia, and it get converted to columnar epithelia because of stress. The stress here is the reflux. In lower esophagus, because of the reflux of acid from the stomach to the lower esophagus, the squamous epithelia, which is normally present in esophagus, will get converted to columnar, and such esophagus is known as Barrett esophagus. I will draw the diagram. And second example I have already quoted, the female ectocervix. The female ectocervix, not endo. Endocervix is an example of squamous epithelia. squamous metaplasia. The female actocervix. Normally, female actocervix has squamous epithelia, and because of HPV viral infection, the squamous get converted to columnar. So here we are having only two organs, two examples. So you can see here in this diagram, normally it is squamous epithelia. You can appreciate this all is squamous epithelia. But due to the stress, it is converting into columnar. You can appreciate the glands here. Glands means columnar. These are the glands. Glands means squamous is gradually replaced by columnar. So this is a diagram depicting the same. The two examples are written in front of you. It is Barrett esophagus, in which the stress is the reflux, and the cervix erosion, the actocervix erosion, in which the stress is the HPV virus, you can say. So I will draw the two diagrams for you for this. So you can see this is esophagus and this is stomach. The normal lining of stomach is columnar. This is columnar lining, but the lining of esophagus is squamous. So I'm drawing columnar with red color and I'm drawing squamous with blue color. So this is squamous, right? Now acid, where is acid present? Acid, we all know acid is present in the stomach, not in the esophagus. So this is acid in the stomach. So the columnar lining given in the stomach can bear the stress given by this acid. But in some humans, acid do the reflux, and because of reflux, it is coming in lower esophagus and hitting the lower esophagus again. So stress here is the reflux of the acid. Now the squamous epithelia in the lower esophagus cannot bear this stress. So it will do adaptation, it will do metaplasia, and it will convert from squamous to columnar. So this esophagus, this fragment of the esophagus, this segment or portion of the esophagus in which squamous get converted to columnar epithelia, it is known as Barrett esophagus. So this is a diagram showing Barrett esophagus, and Barrett esophagus is a risk factor for adenocarcinoma of esophagus in future. So you can say it is a very important risk factor for adenocarcinoma, and the patient should be in continuous surveillance. Such patients having Barrett esophagus. And the second diagram, the second example, that is female actocervix, I have already drawn the diagram. So here we end metaplasia and we start dysplasia, the second adaptation for this lecture. So what is dysplasia? Let's start dysplasia. Dysplasia is disordered cellular development. It is disordered cellular development. What do you mean by disordered cellular development? So in the cell, I will show you few changes which will lead to disordered cellular development, and it is a pre-malignant lesion. Dysplasia is pre-malignant. It can lead to carcinoma in situ or invasive carcinoma in future. So that is the thing. You can see the 7 changes I am talking about. These are known as cytological changes. This is the definition of dysplasia. I will explain you all these changes in this diagram. Can you see the two diagrams? The first diagram, which is on the left hand side, you can see this diagram is normal epithelium, normal endocervical epithelium. On the right hand side, you can see the dysplastic, the same epithelium converted dysplastic. So let's talk about the changes one by one. The first one is increased number of layers. Compare the two diagrams in front of you. Can you see in normal only one layer of the cell is there? You can see this is the one layer, only one layer. But here the number of layers of the cell is increased. You can appreciate the number of the cells is increased. So that is the first change, increased number of layers in dysplasia. The second change, it is disordered arrangement of the cell. Disordered arrangement of the cell from basal layer to superficial layer. Now there are multiple layers. In dysplasia, you can appreciate the multiple layers. In these multiple layers, the cells are arranged disordered. It is disordered arrangement of the cell. So number one, the cells are multi-layered. It is not single layer, it is multi-layered. And in multi-layered also it is disordered arrangement. That is the second thing. The third thing is loss of polarity. What is loss of polarity? Loss of basal polarity and pleomorphism. The next two things. I will explain you these two here. You can see, let me explain you loss of basal polarity. If you can see normal cells, in a normal epithelium, endocervical epithelium, where is the nucleus of all cell? The nucleus of all cell is towards the basement membrane. It is not central. If you can appreciate the location of the nucleus, it is towards the basement membrane. So in normal endocervical epithelium, the nucleus is towards the basement membrane. It is known as basal polarity. It is known as basal polarity, means nucleus is present towards one of the pole. Basal polarity is a normal phenomenon. But when this basal polarity is lost, that is in second diagram, you can see inside the cells, the nucleus is lying anywhere. It can be central, it can be eccentric, it can be anywhere. It is not that it is always towards the basement membrane. So can I say the basal polarity which was present normally, it is lost here. So loss of basal polarity is a feature of dysplasia. Basal polarity is a normal feature, but the loss of basal polarity is a feature of dysplasia. You can read the definition of loss of polarity, basal polarity here. So normally the nuclei of the epithelial cells are oriented along the basement membrane. So they are towards the basement membrane. This is known as basal polarity. But in dysplasia, the tumor cells lose the basal polarity and the nucleus lie away from the basement membrane, or they are haphazard lying anywhere. The next feature of dysplasia is pleomorphism. What is pleomorphism? In the first diagram, you can see normally all cells are same size. All the cells are of nearly same size. But in the second diagram, in dysplasia, you can see some cells are small, some are large. So size is not same. Say a size is variable. The various cells have various size. Variation in size is known as pleomorphism. So normally pleomorphism is absent, but in dysplasia you can see pleomorphism is present. So in dysplasia, basal polarity is lost and pleomorphism arises. You can say that. The two properties. What is pleomorphism? It is variation in size and shape of the dysplastic cell, tumor cells. So these are the four properties we have discussed. The fifth one is NC ratio. What is NC ratio? You can understand here NC ratio. You can see in normal cells. In normal cells, these are the cell. Now, in each cell, appreciate the size of the cytoplasm, appreciate the size. Let me draw a normal cell here. This is a normal cell. The nucleus is towards the base. Okay. Now, in this cell, appreciate the size of the cytoplasm and appreciate the size of the nucleus. The size of the nucleus. It is known as NC ratio. Nucleus cytoplasmic ratio. Nucleus is the numerator, cytoplasm is the denominator. Let's draw a dysplastic cell. In dysplastic cell, loss of basal polarity is there. So nucleus is not towards the basement membrane. It is away from the basement membrane. You can see the diagram here. In this diagram, now appreciate the size of the nucleus and the cytoplasm. You can appreciate the change by yourself. What is the change here? You will say, you can appreciate the size of the nucleus is increasing. The size of the nucleus is increasing and cytoplasm is decreasing. So numerator is increasing, denominator is decreasing. So overall ratio will increase. So in dysplasia or in malignancy, NC ratio increases. That is the meaning. You can appreciate the change in these diagrams which are drawn on the left hand side and right hand side. On the left hand side, calculate NC ratio here and calculate NC ratio here. You will find on the diagram in dysplasia, the right hand side diagram, the nucleus are more in size and cytoplasm. Appreciate here. I am drawing the cytoplasm with red color and I am drawing the nucleus with blue color. You can appreciate nucleus is increasing in size and cytoplasm is decreasing in size as compared to normal. This is NC ratio. The next property is hyperchromatism. Hyper means more. Chroma means color. Chroma means color. See the color of the nucleus. Here the chromatin, the DNA become more packed in dysplasia. So the nucleus is looking more dark. So hyperchromatism is a feature of dysplasia. Now compare the color of the nucleus normally and the color of the nucleus in dysplastic cell. You can see the two diagrams are in front of you. You will find in dysplastic cell, the color of the nucleus is more dark because of the packing of the DNA. That is hyperchromasia. And last is mitotic figures. What are mitotic figures? You know, whenever cell division takes place inside the nucleus, you can see the spindle formation. That is mitosis. Normally, you hardly find any mitosis, but here you will find mitotic figures very frequent. So, if you see in this diagram, if you see the zoom version, you can find some spindles here, some spindles here. So, these are mitotic, the dividing cells. So, mitotic figures are very common in dysplasia. So, in these images also, please appreciate this cell. This is mitotic one, this is mitotic. Can you appreciate the spindles here? Okay, let me show you this. See the nucleus of this 4 cells in front of you. All these 4 cells are showing the mitotic nucleus, the dividing nucleus, the spindle forming nucleus. So you will find these figures very frequently in dysplasia as compared to normal epithelium. So let me summarize what we have learned in this lecture. In this lecture, I taught you the 2 cell adaptations, dysplasia and metaplasia. What is metaplasia? Metaplasia is replacement of one type of adult or mature cell by another type of adult or mature cell. There are 2 types of metaplasia, squamous and columnar. In squamous metaplasia, the columnar convert to squamous. In columnar metaplasia, the squamous convert to columnar as a result of stress. So when stress acting on the cell, one epithelia converting to other. We have seen the examples of each type of metaplasia in various organs in which because of the stress, these adaptations are taking place. After that, we have seen the second adaptation, dysplasia. What is dysplasia? dysplasia is disordered cellular development. By the word disordered, there are 7 cytological changes which takes place in the epithelium which can be defined as dysplasia. So what are the 7 changes? In the diagram, I have shown you all 7 changes. You can see, appreciate the 7 changes in this diagram. This is normal and this is dysplasia. You can see the changes. Number 1, the first change, increased number of layers. The layers are increased in dysplastic tissue. Second, disordered arrangement of the cells in dysplastic tissue. In normal, it is ordered arrangement. In dysplasia, it is disordered arrangement, the second one. The third one is, you can see loss of basal polarity. So normally basal polarity is present, but in dysplasia, the basal polarity is lost. The fourth one is pleomorphism. So normally all the cells are same shape, same size, but in dysplasia, some cells are small, some are large. So this is known as variation in shape and size. It is known as pleomorphism. The fifth one is ANSI ratio. Normally, ANSI ratio means the nucleus is small, cytoplasm is more. But in dysplasia, reverse happen. Nucleus increases in size. So ANSI ratio increases. The fifth one. The sixth one is the hyperchromatism, the color of the nucleus. Because of compactness of the chromatin material, DNA, the nucleus become darker in dysplastic tissue. That is known as hyperchromatism. And the last is increased mitotic figures. So you can enumerate the 7 features of dysplasia. That is the definition of dysplasia. That's all about this lecture.